So our first talk is Addressing Healthcare Practice and Organizational Factors in Cancer Care by Bob Carlson. Bob spent much of his career at Stanford, where he was both a practicing oncologist and had leadership roles that I think are key in understanding how we do practice. And so he's somebody who has a boots on the ground perspective of this, but in 2013 he transitioned to NCCN, where he is their chief executive officer, and at least from my view has done amazing things at NCCN over the years. It was a great organization when he took over, but it's become far more impactful, I think, in so many ways. And so he has this very national perspective on how we're practicing and the different levers that affect how we practice. So Bob, thank you very much for being here.
Thank you, Larry. We heard in the prior session about a number of challenges that we have in oncology, both today and looking to the future. And after this session, most of the rest of the workshop will be about the visions of how to address those problems, how to various solutions that may exist. In my presentation today, I'm really going to talk about systems that exist today that allow us to accelerate the tempo of change. And as Larry suggested in the earlier talk, many of the solutions to some of our problems actually have been addressed by the business community. And so while I view myself as a clinician and a physician, most of what I'm going to be talking about are actually principles of business that we can borrow and embrace today, and again, I think accelerate the tempo of change. So in terms of topics that I'm going to address, I'm going to talk about issues of quality leadership, high-performance teams, workplace culture, and finally, mentorship. So Manville and Ashkenazi recently published a volume looking at the qualities of senior leadership. And while these are qualities and fundamentals of senior leadership, they argue, as would I, that these same fundamentals exist at all levels of leadership, from the lower level managers all the way up to CEOs and presidents of large organizations. The first is that senior leadership must be able to unite the organization around an exciting, aspirational vision. And aspirational here is something that probably can't be achieved. It may be a little bit beyond what is possible to achieve in a reasonable time frame, but it's aspirational and beyond that to force people to innovate, to come up with solutions that are out-of-the-box solutions. And it really should be a vision of what you want the organization or the system to become, not what it is today. It's not a mission. It's not the reason for existing. It's what you want it to become in the future. Once people are united around that vision, you need to figure out a way to actually achieve the vision. In most organizations, this would come from a formal strategic plan. It's a common document that everyone can refer to, and it outlines how the organization can actually achieve the vision. What are the steps? And with that strategy or structure should also go metrics. When can you declare success? What are your goals that you should actually achieve as part of that? And you also need to attract and retain the best talent possible. This is another way of saying Joe Simone's maxim of medicine: always hire people who are smarter than you are. And it's really a diversity of talent that needs to be attracted. But it's not enough to just attract them. You must be able to actually retain them. And we'll talk a little bit more about that further on. And then you need to relentlessly focus on results. It's not okay to give someone a task or give a team or a program a task. You actually need to follow that along and be sure that they actually achieve it. And this is really where metrics become really, really helpful, because once everybody embraces a given metric or a system of accomplishment, you can then hold them to it over time and come back to that and say, you know, you're 80% of where you need to be. Where's that other 20%? And in a collegial, friendly way, not in a critical way. And then you need to be able to also create ongoing innovation to reinvent the vision and strategy. Things are changing too quickly today to be comfortable with a vision from 3 or 4 years ago. You need to continually look at where you're headed, what you want the organization to be, and also to figure out strategies for actually accomplishing that. You've got to keep moving forward. And then finally, leaders need to lead themselves. You need to be relentlessly self-critical, to look at how you behave, how you address problems, hold yourself to the same standard that you would anyone else within the organization. I would add to those the need to communicate. And in this context, communication is not a one-way street. It's not leadership communicating to others in the organization. But what I have found is that if you listen carefully enough, if you intensely listen, almost always the solution already exists within your organization, or the concept or idea for the solution. So that communication is not only communicating the vision, the strategies, and so forth, but it's listening intensely. And then there should also be an intention to develop workplace culture, and I'm going to come back to that also in a minute. So let's move on now to sort of not the macro level, but the micro level in terms of high-performance teams. So let's talk about some definitions. So the first is the definition of a group. It's a collection of individuals that generally function independently, but for some common purpose. We can then go to a team, which is a number of people who work together for a common goal, often with a defined set of rules and with specific roles. You can think of a football team, rule-based, specific roles for each player on the team. A high-performance team. It's a cohesive team with a shared vision, commitment to shared processes and outcomes, interdependent, with complementary skills, strong lines of communication, mutual trust and respect, high emotional intelligence, and a shared leadership structure. Now, I'm sure that all of you in the room have worked with teams. Probably a few of you have worked with high-performance teams. And what I can tell you is that when you go from being a team to a high-performance team is truly translational, transformational in terms of how you approach the work environment and what you can accomplish. So some of the characteristics of high-performance teams: shared purpose and goals, shared leadership. Everyone is empowered. Strong relationships and strong channels of communication. Everyone has defined roles and responsibility, but there's flexibility. If the nursing assistant is too tired or too distracted or has some other obligation so that she can't room a patient, no reason why the physician can't do it. It all relates to flexibility in roles and covering for each other in a dynamic, fluid way. High emotional intelligence. Are you doing okay? That patient had a really hard time, and I saw you starting to tear up. Are you okay? Being aware and supporting each other, especially important within the oncology environment. And finally, mutual trust and respect. I would also add to this consistency in roles. If you're going to have a high-performance team, the nursing assistant is not a widget. The nursing assistant that is working with you needs to be the same one continually. It's not an interchangeable role, because otherwise you don't have the mutual trust and respect for each other and an understanding of strengths and weaknesses and roles for each of the individual players. Some of the benefits of these high-performance teams: they're highly productive. They blow other teams out of the water. They're very highly rewarding for individuals to participate in. They therefore improve morale. People are much happier. It facilitates talent retention because people feel empowered, they feel appreciated, and they're happy. And high-performance teams can be intentionally developed. But I would say that not only can they be intentionally developed, if you're going to have one, it has to be intentionally developed. These are not things that just happen. They're things that take energy and a lot of work in order to accomplish effectively. What about workplace culture? So what is workplace culture? It's really sort of the personality of an organization. It's how the organization does things internally facing, but also externally facing. So it's how do people experience the organization as a whole. And a positive workplace culture attracts and retains high-performing individuals. It makes for a happy workforce, and there's a strong literature to this. It's tightly related to achieving success within an organization. So what's some of the data about that? Well, let's look at workplace incivility, a negative cultural environment. A recent study showed that 62% of employees at Fortune 1000 companies experience incivility on at least a monthly basis. At least a monthly basis. This was a huge drain on leadership and management, with about 13% of leadership and management time devoted to the fallout from this incivil behavior. So that translates into 7 weeks a year of each leader and manager simply mopping up after incivil behavior has occurred within the workplace. So what's the negative impact of all of this? 80% of employees said that they lost work time in terms of their reaction to this behavior and worrying about it. 78% decreased their commitment to the organization. 66% had a performance decline that they acknowledged. 48% decreased work effort. 38% intentionally decreased work quality. So what that means is that 25% of the workforce in those organizations intentionally, not unintentionally, intentionally decreased the quality of their work. Huge drain on the performance of an organization. And 12% of the employees actually left their job because they found their workplace incivil or hostile. So huge impact on the organization. So what impacts the quality of the workplace environment? How can we improve it? Certainly leadership style does. If the leader is not civil to others around them, is not polite, is not nice, not courteous, no one else in the organization is going to be, because that person is looked at as the model. Again, leaders need to lead themselves. Management style falls down from that. Workplace expectations influence workplace culture. Work-life balance. Compensation. Do people feel appropriately valued in what they do? Internal promotion. Is there upward mobility within the organization, or is always the new person brought in from the outside? And behavior. Just how do people tend to behave with each other? Workplace environment, physical environment makes a difference here. People want to be comfortable. They want to feel valued in their work environment. And then again, communication. Realizing again that communication is both from leadership to staff, but also from staff to leadership. So one of the ways to deal with this is to establish core values for the organization. It's really the how of what an organization does. It's not what it does. It's once it's defined about what should be done, how do you go about accomplishing that? And it should be have an explicit and shared vision across the organization, and everyone in the organization is held accountable to those core values. Now at NCCN, we actually had a group of individuals. Anyone at the director or higher level was prohibited from serving on the committee, but we had a committee of staff that came up with a set of core values for us now almost 6 years ago. And these are the 6 that they came up with: excellence, collaboration, respect, integrity, passion, and innovation. And each of those in the document is explained more fully, but you can get the sense that these are the sorts of things that people wanted to be known for as individuals, and that they wanted our organization to be known for. This sets a standard so that everyone can be measured against the same metric, and it has the same expectations of behavior. Well, what about mentorship? So what is mentorship? So it's a developmental, empowering, and nurturing relationship extending over time, in which mutual sharing, learning, and growth occur. It's a two-way process with learning for both parties. Thus, it is acknowledged that mentoring is likely to be reciprocal, in that wisdom is not handed down in a one-way transaction, Rather, both mentor and mentee share knowledge, insight, and skills. So what are some of the advantages or value of the mentor-mentee relationship? Mentees, at least within academic science circles, are more successful. They're more likely to get promoted, and they get promoted more quickly. They're more productive. They do more research, they get more research grants, they publish more papers. There are higher retention rates among faculty who have a mentor-mentee relationship, and they report improved career satisfaction. So what are some of the attributes of outstanding mentors? They have admirable personality characteristics or qualities. They're just nice people, and they're good role models. They act as a career guide for the individual, and that I emphasize individual. They have a strong time commitment. They meet with the mentee regularly, and they're available between scheduled visits for discussion. They support work-life balance. It's not all about work. And they also have the benefit of leaving a legacy of mentoring behind them. So in summary, there are effective models and characteristics for leadership that are available today and that can accelerate change. High-performance teams can be developed intentionally and that improve performance outcomes and team member satisfaction. Identification of organizational core values can align expectations of behavior and facilitates a strong, positive organizational culture. Formal mentoring programs accelerate the development of new talent and the evolution of established talent. And all of these are really essential to rapidly evolving contemporary and future oncology care to respond to workforce demands created by innovation, the increased complexity of cancer care, and workforce demands. Thank you.